Samantha, a veterinary technician, receives a call from a client whose dog has just been hit by a car. The dog is bleeding heavily from a wound on its hind leg and is showing signs of shock, pale gums, rapid breathing. The client is unsure how to handle the situation until they can get to the clinic, which is 30 minutes away. What should Samantha advise the client to do in this situation, considering both immediate first aid and the principles of shock management? Answer: Samantha should instruct the client to take the following immediate steps. Control bleeding. The first priority is to control the bleeding. This can be done by applying pressure directly to the wound using a clean cloth or bandage. If the bleeding is severe, a tourniquet may be necessary above the wound. Careful not to apply it too tightly or for too long. Shock management. The dog is showing signs of shock, which means blood flow to vital organs is compromised. To manage this, the client should keep the dog warm by covering it with a blanket and ensure that the dog is kept as still and calm as possible to prevent further strain on the circulatory system. Monitoring vital signs. The client should monitor the dog's breathing rate and pulse and note any changes. The veterinarian will need this information once the dog arrives at the clinic. Transporting the animal. When transporting the dog, it is crucial to do so gently, avoiding any jarring movements. The dog should be kept as comfortable as possible, ideally laying on its side with its legs slightly raised if possible to improve blood circulation. What are the key steps in performing an effective bandage application for a wound on an animal's leg, and what are the potential complications that may arise if the bandage is applied incorrectly? Answer: the steps for an effective bandage application are: clean the wound before applying any bandage. The wound must be cleaned gently with sterile saline or an antiseptic solution to remove dirt and debris. Apply an absorbent layer. Place a sterile non-stick pad over the wound. This prevents the bandage from sticking to the wound and helps absorb any fluid or discharge. Secure the bandage. Use a conforming gauze bandage or a similar material to wrap the limb, ensuring that the bandage is snug but not too tight. Overlapping the layers evenly is essential to avoid pressure points or restriction of blood flow. Protection layer. Over the gauze, a cohesive bandage can be used to hold the dressing in place. This layer should be elastic but not restrictive. Check for circulation. After bandaging, check for signs of proper circulation such as capillary refill time and pulse in the distal limb. The bandage should not impair circulation. Monitor the bandage. The bandage should be checked regularly for signs of infection, swelling, or irritation. Complications. Incorrect application can lead to several complications, including excessive tightness. This may compromise blood circulation and lead to tissue necrosis. Loosening of the bandage. A loose bandage can lead to further contamination of the wound and inadequate protection. Infection. If the bandage is applied over an unclean wound, it can promote bacterial growth and result in infection. These steps align with the guidelines set by the Australian Veterinary Association (AIVA) for animal first aid and wound management. Dr. Carter, a veterinarian, has prescribed a topical antibiotic ointment to a cat with a superficial wound on its back. The cat is difficult to handle and often scratches at the wound area. Dr. Carter has instructed that the ointment be applied twice daily. What strategies can Dr. Carter suggest to ensure the cat receives the treatment consistently and safely while minimizing stress for the animal? Answer: Dr. Carter can suggest the following strategies. Restraint techniques. Dr. Carter should recommend safe and gentle restraint techniques, such as wrapping the cat in a towel, a kitty burrito, to prevent scratching. This will minimize the stress on the cat and help ensure that the medication is applied effectively. Positive reinforcement. To associate the application of the ointment with a positive experience, Dr. Carter can suggest giving the cat treats or affection immediately after the medication is applied. Frequent monitoring. The owner should check for any adverse reactions such as irritation or allergic responses to the ointment and report these to the veterinarian promptly. Alternative medication forms. If the topical ointment is proving too difficult, Dr. Carter may consider switching to an oral antibiotic or a long-acting injectable form of the medication, which may be easier to administer to the cat. These recommendations align with the Australian veterinary practice standards, which focus on effective, humane, and stress-reducing practices in administering animal care. What are the critical steps involved in performing CPR on a dog, and how does the process differ from performing CPR on a human? Answer: CPR for a dog involves the following critical steps. Assessing the situation. Confirm that the dog is unresponsive and not breathing. Check for a pulse. If there is no pulse and the dog isn't breathing, begin CPR immediately. Chest compressions. Place the dog on its side on a firm surface. For medium to large dogs, place one hand over the widest part of the chest and compress downwards. For smaller dogs, use both hands with your fingers around the rib cage. Compress about 30 times at a rate of 100-120 compressions per minute. Rescue breathing. After 30 compressions, give 2 rescue breaths by sealing the dog's mouth and blowing air into the nose until the chest rises. Repeat cycle. Continue this cycle of 30 compressions and 2 rescue breaths until the dog starts breathing on its own or until emergency help arrives. Differences from WHO and CPR. For dogs, chest compressions are performed over the heart area, while for humans, compressions are delivered at the center of the chest. The compression depth for dogs is typically 1/3 of the chest's width, whereas for humans it's about 2 inches deep. Mr. Thompson owns a female rabbit that has recently gone through a season. He is unsure whether the rabbit has been bred successfully and asks for your help in understanding the reproductive cycle and how to determine pregnancy. What advice should you provide Mr. Thompson on how to identify a pregnant rabbit and the timing for breeding? Answer: Mr. Thompson should be advised on the following. Estrus cycle. Female rabbits are induced ovulators, meaning they do not have a regular estrus cycle but can ovulate when mated. They are receptive to breeding during the estrus phase, which typically lasts 1-2 days. Signs of pregnancy. Pregnancy in rabbits can be detected by changes in behavior, e.g., nesting behavior, physical changes such as weight gain and a palpable firm abdomen, typically visible around day 14-16 of gestation. A vet can perform an ultrasound to confirm pregnancy. Breeding considerations. Rabbits can be bred at around 5-6 months of age, but they should not be bred too frequently to prevent health complications. It is essential to monitor the rabbit's health, providing proper nutrition and ensuring a stress-free environment during pregnancy. The Australian Animal Welfare Standards and Guidelines for Rabbits advise on best practices for breeding and managing reproductive health in animals. What are the key ethical and practical considerations in managing breeding programs for companion animals? Answer: Key ethical and practical considerations include genetic health, ensuring that animals selected for breeding are free from genetic disorders to reduce the risk of hereditary health issues in offspring. Genetic testing and screening should be conducted. Health of the female. Breeding should only occur when the female animal is in optimal health. Overbreeding can cause health issues such as uterine infections or other complications. Welfare of the offspring. It is important to ensure that offspring are born into healthy and safe environments. This includes providing proper prenatal care for the female and appropriate handling and socialization for the newborns. Legal and ethical standards. Adhering to regulations such as the Animal Welfare Act 2002, which governs breeding practices in Australia, ensuring that breeding practices do not cause harm to the animals involved. What are the primary challenges associated with caring for neonates in veterinary practice, and what guidelines should be followed for successful rearing? Answer: Primary challenges in neonatal care include thermoregulation. Neonates cannot regulate their body temperature effectively. It is essential to maintain an appropriate environment with supplemental heating sources. Feeding. Neonates often require special formulas or milk replacements, especially if the mother is not available. Feeding must be frequent and volume should be adjusted based on weight. Monitoring development. Neonates should be monitored regularly for signs of dehydration, failure to thrive, or infection. Any deviation from expected growth patterns should prompt immediate veterinary attention. Guidelines. The Australian Veterinary Association, AVA, and the Australian Animal Welfare Standards recommend strict adherence to neonatal care protocols to ensure healthy development and minimize risks. Lydia is helping her dog, Bella, who is in labor. Bella has already delivered one healthy pup but seems to be struggling to deliver the second. Lydia is unsure if this is normal or if Bella needs assistance. What steps should Lydia take to assist Bella, and what signs indicate that the situation may require veterinary intervention? Answer: Lydia should take the following steps. Assessing the situation. It is important to monitor the progress of the birth. If Bella is having contractions and pushing without delivering a pup for more than 30-60 minutes, veterinary assistance may be needed. Physical assistance. If the second pup is visible and partially out but stuck, Lydia can gently help by providing some gentle traction while Bella pushes. However, she should avoid pulling too forcefully, as this can injure the mother or pup. Signs of complications. If Bella shows signs of extreme distress, such as excessive bleeding, lethargy, or failure to pass the placenta, Lydia should seek immediate veterinary help. Prolonged labor or dystocia, difficult birth, can lead to serious complications. The Australian Animal Welfare Standards recommend careful monitoring and seeking professional veterinary assistance if complications arise. What are the key factors that influence reproductive success in farm animals, and how do they affect breeding protocols? Answer: Key factors influencing reproductive success include genetic selection, choosing breeding animals with desirable traits, including good health and genetic diversity, is essential for ensuring a productive and healthy herd or flock. Nutrition. Proper nutrition is critical for fertility. Deficiencies in vitamins and minerals can result in low conception rates or birth defects. Environment. Stresses such as extreme temperatures, overcrowding, and poor housing conditions can negatively affect reproductive outcomes. Animals should be housed in environments conducive to their reproductive needs. Health monitoring. Regular health checks are essential to ensure that reproductive organs are healthy and free from disease. Breeding protocols must be adapted to these factors, ensuring optimal conditions for successful reproduction and long-term health. These protocols are guided by industry standards such as the National Animal Health and Welfare Strategy. What are the key aspects of postpartum care for female animals after delivery, and why is this care critical for both the mother and offspring? Answer. Postpartum care includes monitoring the mother. After birth, the mother should be monitored for signs of complications including excessive bleeding, infection, or retained placenta. Nutritional support should be provided to aid in recovery, supporting lactation. Ensuring that the mother is able to nurse her young is crucial. Any signs of mastitis, breast infection, or failure to produce milk should be addressed immediately. Cleaning and sanitizing the birthing area. To prevent infection, the birthing area should be cleaned and sanitized regularly. Vaccination and health checks. The mother should receive a postpartum health check to ensure that she is recovering properly and to address any potential issues. Postpartum care protocols are essential to prevent complications and support the health of both the mother and offspring. The Australian Veterinary Association either provides guidelines on best practices for postpartum management. What are the key steps in hazard identification and risk management in an animal care environment? Provide examples of hazards and explain the legal and workplace guidelines that must be followed to minimize risk. Answer. The key steps in hazard identification and risk management include hazard identification, recognizing any potential sources of harm. In animal care settings, hazards can be biological e.g. zoonotic diseases, physical e.g. animal bites or kicks, ergonomic e.g. improper lifting techniques, and chemical e.g. exposure to disinfectants or medications. Risk assessment, evaluating the likelihood and severity of harm from each identified hazard. For example, the risk of contracting a zoonotic disease may be higher in a facility that houses exotic animals. Control measures, implementing strategies to eliminate or reduce risks. This might include proper animal handling techniques, providing personal protective equipment (PPE), or safely storing chemicals. Monitoring and review, continuously assessing the effectiveness of implemented control measures and updating them as necessary. Training and education, ensuring staff are properly trained to recognize hazards and understand risk management protocols. Why is safe handling of equipment and chemicals critical in animal care settings, and what guidelines govern this practice? Answer. Safe handling of equipment and chemicals is critical in animal care settings to prevent accidents that could harm both staff and animals. Equipment and chemicals often pose physical, chemical, and biological hazards, and improper handling could lead to injuries, contamination, or even fatalities. Guidelines for safe handling. Training. Staff must be properly trained on how to handle equipment and chemicals safely. For example, handling chemicals such as disinfectants requires understanding the correct dilution ratios and proper PPE usage. Gloves, masks. Storage. Chemicals should be stored according to the manufacturer's instructions, usually in secure, well-ventilated areas away from animals and food sources. Proper equipment maintenance. Regular checks and maintenance of equipment like restraint devices, grooming tools, and cages are necessary to ensure their safe operation and prevent malfunctions. Spill response plans. A well-communicated and practiced spill response procedure must be in place for hazardous chemicals. What types of personal protective equipment (PPE) are recommended for animal care workers, and how do the relevant laws govern their use in a workplace? Answer. Personal protective equipment (PPE) is essential for protecting animal care workers from various hazards, such as animal bites, scratches, chemical exposure, and zoonotic diseases. Key types of PPE include gloves to protect against bites, scratches, and chemical exposure, face shields or goggles to protect the eyes and face from splashes of chemicals or bodily fluids, footwear, closed-toed shoes or boots to protect against animal bites, sharp objects or spills, aprons or overalls to protect skin from chemicals and animal fluids, masks or respirators, to protect against airborne hazards such as animal dander or chemicals. Relevant laws and guidelines. Safe Work Australia guidelines specify the types of PPE required for specific hazards, including animal care environments. The Australian Standards for PPE, ASNS 1337, guide the selection and use of PPE in the workplace. What are the emergency response procedures that must be in place in an animal care facility, and how should workers be trained to respond to incidents such as animal attacks or chemical spills? Answer: emergency response procedures are crucial for minimizing harm during incidents like animal attacks or chemical spills. The procedures should include first aid protocols, having a clear first aid protocol for injuries from animal bites or scratches, chemical spill procedures, immediate evacuation of the area, containment of the spill and proper disposal according to regulatory guidelines, animal escape or aggression, clear guidelines for handling aggressive animals or if an animal escapes, including using tranquilizers or safe traps, communication, ensure clear communication methods, e.g., alarms, walkie-talkies during emergencies. Training guidelines. Workplace health and safety. Publicious training is mandated by law to ensure that workers are trained in emergency response procedures. This includes certification in first aid and CPR for medical emergencies and chemical handling procedures. The Australian Standard for Emergency Response as 3745 sets out guidelines for emergency planning and training. Sarah works in a wildlife rescue centre where she is tasked with ensuring that animals are properly identified and their records are kept accurately. One day, a new kangaroo is brought in, and Sarah needs to decide on the method of identification. What is the most appropriate method for identifying the kangaroo, and how should Sarah maintain the animal's health and medical records? Answer: in Sarah's case, the most appropriate method of identification for the kangaroo would likely be a microchip, as it provides a permanent, unique and tamper-proof identification method. Tattoos or ear tags may also be used, but they are less reliable in certain species. Microchips are widely accepted and legally required in some jurisdictions for animal identification. Record keeping. Sarah should maintain accurate health and medical records for the kangaroo, which must include identification details, information on the microchip number, physical description, and any distinguishing features, health and medical history, records of vaccinations, treatments, surgeries, and any illnesses, legal documentation, any legal requirements for holding wildlife, including permits and certifications as per the National Parks and Wildlife Act, regular updates, continual updating of the animal's records, especially during health checks or treatments. What are the advantages and disadvantages of using microchips, tattoos, and ear tags for animal identification? How do legal requirements influence the choice of identification method? Answer: each method of animal identification has its advantages and disadvantages. Microchips. Advantages: permanent, tamper-proof, cannot be lost or damaged easily, and can be scanned at any time. Disadvantages: requires a scanner to read, and there is a risk of failure if the chip migrates. Legal influence: many states and territories require microchipping for certain species, particularly pets. Tattoos. Advantages: visible and permanent. Disadvantages: can be altered or become illegible over time. Legal influence: often used for livestock and certain wildlife, but less common in companion animals. Ear tags. Advantages: easy to apply and visible. Disadvantages: can be lost or damaged. Legal influence: commonly used for livestock but may not meet the standards for pets or wildlife in some jurisdictions. Relevant guidelines: National Animal Identification and Tracing (NAIT) scheme mandates specific identification methods for livestock. Australian Animal Welfare Standards and Guidelines dictate acceptable identification methods for various animal species. What legal documentation must be kept in an animal care facility, and how should this documentation be managed to ensure compliance with relevant animal welfare laws? Answer: legal documentation in an animal care facility must include animal identification records, information on each animal's identification, medical history and ownership or custody status, licensing and permits, documentation for compliance with local, state and federal laws regarding animal care, such as wildlife permits or zoo licenses, health and safety reports, records of any workplace injuries, safety audits or inspections, training and certification records, documentation of staff training including first aid, animal handling and emergency response courses. Management guidelines. Documentation should be maintained in both physical and electronic forms with backups to prevent loss. All records must be kept for the legally required period, typically 7 years for medical and welfare documentation. The Animal Welfare Act 2002 (CTH) sets out the documentation standards for animal care facilities. What are the main regulatory bodies overseeing animal welfare and safety in Australia, and what are their primary responsibilities regarding animal care facilities? Answer: in Australia, several key regulatory bodies oversee animal welfare and safety. Australian Animal Welfare Standards and Guidelines (AWS). These set out the minimum welfare standards for animals used in research, farming, and as pets. RSPCA Australia provides advocacy, guidance, and enforcement of animal welfare laws. Department of Agriculture, Fisheries and Forestry administers laws related to the movement of animals across state borders, biosecurity, and agricultural practices. WorkSafe Australia ensures compliance with workplace safety standards, including those related to animal care and handling. What are zoonotic diseases, and what steps should animal care workers take to minimize the risk of transmission? Answer: zoonotic diseases are infections that can be transmitted from animals to humans. Examples include ringworm, salmonellosis, rabies, and leptospirosis. Steps to minimize risk: personal hygiene, frequent hand washing, especially after handling animals or cleaning enclosures. Protective equipment, use of gloves, masks, and protective clothing when handling animals or their waste. Vaccination, ensuring that staff are vaccinated against diseases like rabies if working with high-risk animals. At animal health monitoring, regular veterinary checks to identify and manage infections in animals. Education and training, teaching staff about zoonotic diseases and how to prevent transmission. Relevant guidelines. Safe Work Australia provides zoonosis guidelines specific to the agricultural and animal care industries. What factors should be considered when designing housing for animals in care facilities? Answer: animal housing must meet the physiological, behavioral, and health needs of the species. Key factors include space, adequate room for movement, and natural behaviors, e.g., perching for birds, temperature and ventilation, ensuring the environment is within the species' comfort range and well ventilated. Enrichment, adding toys, climbing structures, or other features to stimulate mental and physical activity. Hygiene, housing must be easy to clean to prevent disease. Safety, prevent escape, protect from predators, and reduce injury risks. Group compatibility, ensuring social species are housed in compatible groups while territorial or solitary species are separated. Legal requirements. The Australian Animal Welfare Standards and Guidelines specify minimum space and enrichment requirements. Local council regulations may impose additional guidelines for housing exotic or native wildlife. Explain the importance of vaccination schedules in animal care. What could happen if vaccination protocols are not followed correctly? Answer: vaccination schedules are critical for the health and welfare of animals. They help prevent the spread of infectious diseases, safeguard the animal population, and protect public health by controlling zoonotic diseases. Key reasons for adhering to vaccination schedules include herd immunity. Vaccination of a significant portion of the animal population prevents outbreaks. Protection against zoonotic diseases. Vaccines like rabies protect both animals and humans. Prevention of disease progression. Early vaccinations reduce the risk of severe symptoms or fatalities. Failure to follow these protocols can result in disease outbreaks. Animals may contract preventable diseases, leading to high morbidity and mortality rates. Increased zoonotic risk. Diseases like leptospirosis may spread to humans. Legal and ethical implications. Neglecting vaccinations can breach animal welfare laws, such as the Animal Welfare Act 2006, which mandates responsible care. Emily is a vet nurse in a small animal clinic. A client brings in a puppy, Max, who has missed his second round of core vaccinations due to the owner's busy schedule. Max is now 6 weeks overdue. What should Emily recommend to the client? Answer: Emily should explain the risks of delayed vaccinations and recommend restarting the vaccination protocol to ensure full protection. Specifically, assess Max's health. Conduct a physical exam to ensure Max is healthy for vaccination. Restart vaccination schedule. Administer the first dose immediately and schedule the follow-up vaccines based on current health guidelines, such as the WSAVA vaccination guidelines. Education. Inform the owner about the risks of diseases like parvovirus, which is particularly dangerous in puppies. Legal compliance. Document the vaccination history to ensure compliance with animal welfare legislation, emphasizing the importance of timely vaccinations. Failure to act could leave Max vulnerable to preventable diseases and the owner legally liable if the puppy transmits zoonotic diseases. What are the main differences between infectious and non-infectious diseases in animals? Provide examples of each. Answer: infectious diseases caused by pathogens, e. G. Bacteria, viruses, fungi, parasites can be transmitted between animals or from animals to humans. Examples: rabies, viral, a fatal zoonotic disease, canine parvovirus, a highly contagious viral infection. Non-infectious diseases result from genetic, environmental, or nutritional factors, non-transmissible. Examples: diabetes mellitus, a metabolic disorder, hip dysplasia, a genetic orthopedic condition. Understanding these differences helps veterinary professionals implement targeted preventive measures, including vaccination for infectious diseases and dietary management for non-infectious conditions. What ethical considerations should be made when performing euthanasia on an animal, according to animal welfare legislation? Answer: ethical euthanasia involves ensuring that the procedure is necessary, humane, and aligns with legislative guidelines. Key considerations include justification, confirm the procedure is in the animal's best interest, e.g., to alleviate intractable suffering. Owner consent, obtain informed consent explaining the reasons and process. Humane methods, follow guidelines such as those in the AVMA guidelines for the euthanasia of animals, ensuring minimal distress. Legislation compliance, adhere to the Animal Welfare Act and any state-specific laws regarding the method and circumstances of euthanasia. Documentation, record the procedure including reasons and methods used for legal and ethical accountability. Failure to consider these aspects can result in legal repercussions and ethical violations. Dr. Ahmed is performing a post-mortem examination on a cow suspected of dying from anthrax. What precautions should Dr. Ahmed take to protect himself and others? Answer: Dr. Ahmed should follow strict biosecurity measures due to the zoonotic nature of anthrax. Recommended steps include personal protective equipment (PPE), wear gloves, masks, and full body suits to prevent contact with spores, work in a controlled environment, perform the post-mortem in a designated facility to contain contamination, disposal of remains, incinerate or bury the carcass deeply as per the Biosecurity Act 2015. Notification: report the case to veterinary authorities as anthrax is a notifiable disease under OIE. Guidelines: vaccination, ensure exposed individuals and livestock in the area are vaccinated against anthrax. Failure to follow these protocols could lead to severe health risks and legal consequences for Dr. Ahmed and the clinic. Describe the key features of zoonotic diseases and provide strategies for their prevention in animal care facilities. Answer: key features of zoonotic diseases transmissible from animals to humans include bacterial e.g. leptospirosis, viral e.g. rabies, and parasitic e.g. toxoplasmosis. Diseases often involve direct contact, contaminated surfaces, or vector transmission. Prevention strategies: hygiene practices, regular hand washing and disinfection of equipment, vaccination, ensure animals are vaccinated against zoonotic diseases, education, train staff about risks and protective measures, biosecurity, isolate infected animals and control access to facilities, adhering to the Code of Practice for Biosecurity and national health regulations mitigates risks effectively. Why is active listening critical when communicating with clients in animal care, and how can it be effectively practiced? Answer: active listening ensures that the client feels heard and understood, which builds trust and improves client satisfaction. In animal care, this is particularly important because clients often express concerns about their pet's health or behavior, requiring sensitivity and clarity. To practice active listening, focus on the speaker by maintaining eye contact and avoiding distractions. Paraphrase and summarize what the client says to confirm understanding, e.g., so you're concerned about your dog's sudden loss of appetite. Ask clarifying questions when needed, such as, could you describe the symptoms you've noticed? Show empathy by acknowledging their feelings, e.g., I understand this situation must be stressful for you. Effective communication in animal care is supported by ethical guidelines like those in the Code of Professional Conduct for veterinary staff, emphasizing respect, clarity, and empathy in interactions. What are the benefits of implementing a comprehensive waste management plan in an animal care facility? Answer: a waste management plan ensures proper handling, segregation, and disposal of waste, reducing environmental impact and promoting sustainability. Key benefits include environmental protection, prevents pollution by ensuring hazardous materials, e.g. used syringes, medication, are disposed of correctly. Cost efficiency, recycling and composting reduce disposal costs and improve resource utilization. Compliance with regulations, meets legal standards such as those outlined in the Environmental Protection and Waste Management Act. Improved workplace hygiene reduces risks of disease transmission and enhances the facility's cleanliness. Facilities should adopt practices like segregating biodegradable waste, setting up recycling stations, and educating staff on proper disposal techniques. Anna, a veterinary nurse, has been scheduled to assist with a surgery. Before the procedure, the attending veterinarian notices Anna wearing bright nail polish and open-toe shoes. What professional conduct standards should Anna follow in this situation, and why? Answer: Anna's attire violates professional conduct and safety standards in an animal care facility. Hygiene: nail polish can harbor bacteria and contaminate sterile environments. Open-toe shoes expose feet to sharps, chemical spills, or animal scratches. Professional appearance: clean, conservative attire and closed-toe shoes demonstrate respect for workplace policies and client expectations. Regulations: standards such as those in the Veterinary Workplace Safety Guidelines mandate appropriate protective clothing to ensure safety and prevent contamination. Anna should promptly change into closed-toe shoes and ensure her nails are unpolished or covered by gloves. Adherence to these standards maintains a professional and safe environment. How should an animal care professional prioritize tasks during a high-demand day? Provide a structured approach. Answer: effective prioritization involves assessing urgency and importance. Create a task list. Write down all tasks to avoid overlooking any. Categorize tasks. Use the Eisenhower matrix. Urgent and important. Immediate tasks, such as responding to an injured animal. Not urgent but important. Long-term responsibilities like updating medical records. Urgent but not important. Delegate tasks, e.g., calling suppliers. Not urgent and not important. Postpone or eliminate unnecessary tasks. Allocate time. Set specific time slots for each task to maintain focus. Reassess as needed. Adjust priorities if emergencies arise. This method ensures critical tasks are addressed promptly without compromising long-term goals.